The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
And it's wonderful to have you with us again. Look at what the title of the program today is, Freedom from Spinal Curvature. Well, maybe you've got a healthy spine and we say praise the Lord. And maybe you've had a few back problems or maybe some serious back problems, and maybe you just want to have a healthy back. Or maybe you have some friends or family members who are having back problems, and we think that we have some good things to offer you today. And certainly that qualifies us as chiropractic physicians to offer some information from the natural perspective. And so we are really pleased to have you with us, and we invite any telephone calls that you may have or letters requesting information on spinal curvature or back problems or any other health problems, because we provide them without any charge, and nobody's going to call you or put you on a mailing list or anything like that. That's not our aim to do that. Our aim is to provide good, credible scientific information from a natural health perspective. And we're going to get right at it with Dr. Richard Jensen, my esteemed colleague, and he's going to start out showing you where some of these back problems start. Now, a lot of back problems, some of them are hereditary, so they're genetic in nature. But it doesn't mean that even when something's genetic that we can't positively influence it or use interventions that are positive. And sometimes that's surgical, but often there are a lot of natural things. But the earlier that we examine a child's spine, the sooner we're going to see if it's developing normally, if there might be some genetic problems there, or maybe due to birth, due to the birth process. Sometimes heads are injured, or arms or legs, or some part of the skeletal frame, including the spine. And of course, these kids take a lot of falls and bumps, and so a lot of times the spine will get jarred out of alignment. The child won't think anything of it, or if they do have pain, it may last a day or something like that. And I know it brings to my mind a child that I recently saw. The mother brought the child in and wanted a scoliosis screening, and we're happy to do that. We do hundreds of those a year, and we're happy to do those. And she said that the child had fallen, and that was complaining of some neck and low back pain, and took him to the medical doctor. And medical doctor, she said, is really a nice person, just a wonderful person. And I said, oh, okay, good. I'm happy to hear that. I know a lot of wonderful medical doctors. And I said, well, what did he do? And she said, well, just looked at him and asked him how he was, and nurse took his temperature. And I said, is that it? And she said, yeah, it was a wonderful visit. He's a very nice person. So I took out the digital camera. We make digital pictures of all of our patients' spines and their x-rays, so we help them develop their own medical file. And we could see the postural alterations very similar to the ones that Dr. Jensen is going to show you here in a minute or so. And she saw that, and it's so apparent that the child had problems. And I said, and what did you get for that visit? And she said, I got nothing. I got nothing. I got a nice person, but I got nothing out of it. And she said, but guess what? My HMO didn't charge me for it. And I said, well, nothing for nothing. And that's exactly what you got. So, Dr. Jensen, let's take a look here, and we have some wonderful positive things to share with you.
Thank you, Dr. Lala. Let's bring up that first slide. What we're going to show you here is, if you see this individual is you can see from left to the right, he has postural deficiencies in here. As you can see, the shoulder, his left shoulder is very low in comparison to the right shoulder. His left hip is low compared to the right, and his left hand is low to the right. He's standing relatively straight, meaning little bends a little bend in his posture. He's more or less swaying to that direction rather than a bend. But it shows that there is a postural insufficiency, which probably relates down to the feet, goes through the knees and the hips, and then the spine has to compensate for that. If you look at it from the side view, he's actually swayed a little bit forward at the hips, points back a little bit at the shoulders, not too much though, and then his head has a forward sway to it. And if you look at that forward sway, it shows a muscular imbalance as well as a postural deformity taking place all the way to the top that can occur from the bottom. Now, with that forward head sway, I can tell you that there's going to be muscles that are tight that are auxiliary breathing muscles and muscles that are directly related to headaches. So this person or a person with this deformity may start to experience some headaches in relation to what's going on around the hips and the feet. Also, with the auxiliary breathing muscles being out like that, they're going to be heavy chest breathers rather than abdomen breathers, which is more of a fight or flight type of response. And this person with exercise would seem to act almost more like an asthmatic, not being able to get a full breath of air. Looking at the backward postural picture, you can, from the back that's on the right-hand side of your screen as you look at it, you can see where the shoulders, his left shoulder again is low, and his hips seem to be a little bit more square at this point. From that, you can see that he's going to have a curve because of the spine is relatively straight at the bottom but curved at the top. He's going to have a curve in that mid-back somewhere that is creating that shoulder to be low. And then you see that how the head comes back and will generally overcompensate going the opposite way due to a reflex to keep our eyes horizontal to the horizon. If we look below him there are a couple pictures of his feet. Yes. And you can see on the left-hand side that actually the heel on that side is higher than, from the left side, is higher than the heel on the right side, showing a leg inefficiency to that one side. If you go to the next view that's on the right-hand side on the bottom, you can see where his foot is actually pronated out on that short side, which generally that's what we see is where the leg is short, it's normally pronated on that side, and when the person stands, they will have a fallen arch on that one side, creating a short leg, which comes all the way up through the spine, because now they don't have a flat base to stand on. The rest of the spine has to compensate for that with different curves. So this type of curve we could have some good success with because it's probably more due to a functional short leg rather than a physiological short leg that's occurring there. And that would dictate the curves in the spine, and that curve in the spine would mean that that the spine will probably straighten out if you correct that. By correcting that means that the spine at this point, because this boy is young, he still has a growing spine, and therefore those insufficiencies that would create deformity of the spine can continue and therefore end up being a permanent deficiency. But when caught young like this, you can generally go back and fix it. There's a lot of hope in this case. Dr. Lala?
Hope. Hey, praise the Lord. That's a wonderful thing that God gives us through His Son, Christ Jesus. And the next slide we're going to look at is look at some normal posture now. So easy to focus on the negative and the bad and the sad. On your far right, we're looking at the individual from the side. And what we see here are the normal three curves in the spine. We're all supposed to have those. Beginning at the neck, see a slight forward sway in the neck, and in the mid-back and the shoulder area there, we see a slight rounding of the shoulders. And then in the lower back, we see a slight sway in the lower back. And we have here a plumb line down this individual, and you can see that it goes right straight through the ears, the center of the shoulders, center of the hips, and the center of the ankle, and that's normal development there. Now the center view of this individual, we're looking at him from the back. We look, there's the plumb line again, and we see the head. It's the earlobes of the head that's nice and level. The neck muscles are of equal contour, size and shape, the way they should be. And the shoulders are nice and level. And then we look at the scapula, and we see that they're of equal height and not too badly flared backwards. And we look down at the muscles of the spine. They are pretty well equal in size and shape, both on the right and left. And then we get down into the lower back, and we see how nice and level the hips are and how that plumb line goes center between the feet. Now on your far left, we see this individual from the front, again following the plumb line, that nice black line that's going down the individual. See, it's right straight through the forehead, the nose, the jaw, center of the chest, abdomen, and right down through the feet. Now a lot of times when people have, like for example, a head tilt, and we'll use the next slide now, and Dr. Jensen will talk about that. It predisposes them not only to a lot of health problems, but it can also predispose them to a health issue called TMJ. And I'm sure Dr. Jensen will bring that up as he's talking about this illustration right here.
If you look at this illustration, it's showing that this person has a right leg that is shorter than the other. And so if you go to his low back where that triangle is, that's actually the pelvis or the sacrum. That is the specific bone that's a triangular bone in the low of the back. And if that forms the base for the spine, if that is tilted, as in this case, off to the right, you will have a compensatory scoliosis in the low back, which is trying to, again, regulate those righting reflexes, keeping the eyes level with the horizon, which will bend the shoulders the other way. And like I said, we normally overcompensate in that so that the shoulder, the left shoulder, will be much lower than the right shoulder if we're looking at this individual from the back. And then that bending, that compensation has to go all the way up the spine to keep the head straight, and the last joint is right up at the base of the skull. Now, being up at the base of the skull, if you have a bend in here, you have now changed the levers in which these muscles work upon. And therefore, you've changed the tone of these muscles and how hard they have to work. And when they have to work hard, there's a muscle here called the rectus capitis posterior minor. That's on the quiz at the end of the show, I remind you. So pay attention to that, rectus capitis posterior minor. What they found is recently, when they were looking at muscles of the neck, from the back they couldn't tell it. They had to look at the muscle sideways, and then they found that it had a little slip of a muscle that went up in through inside the skull and would attach to the covering of the brain. Now the brain doesn't have any pain sensors itself. It interprets pain, but the covering of the brain is highly innervated for pain, and therefore if you put a stretch on that, this person will have a headache that will seem as though it begins back here with a tight neck and wrap up over the ear, ending up in the frontal area of the head. That's just one of the things here. Also, we find with a lot of these individuals is they'll have a forward sway to their neck, coming back like this. Now, this person here, they will have a tightness of this muscle. Because the body adapts, it changes itself. It's remodeling all the time. You might, I don't know if you've ever experienced this, but some people before, when they put their arms in casts, they were supposed to give them exercises in which they'd move their elbows out and turn and twist a little bit just to keep movement in the shoulder joint. If they spent that entire 6 weeks with their arm just plastered back like this, the connective tissue in that shoulder would adhere that shoulder, and they'd have a condition called frozen shoulder. That's because your body is remodeling all the time. In this case, if your head is cocked back like this, these muscles are tight in here, and they will actually remodel to be shorter until you start to call for them to be longer, as in stretching exercises and muscle rehabilitation exercises. And so if they're shorter, this person is predisposed towards being like that for an awful long time until they get corrective spinal care to take care of that. These kind of things, what happens is every time your head is more forward than this, for every inch forward that your ear is from your shoulder, means that this has to put up with 3 times the amount of stress. And if you ever lifted a head, it's like a bowling ball. So these muscles are having to put up with 3 times that amount of weight to hold it up. No wonder people get chronic headaches from that predisposition. Also, if this is off, a lot of times it will change the levers again that are being used in mastication. And so in chewing, that can cause differences in the jaw, and therefore we find many people who have temporal mandibular joint problems actually have what we call subluxations occurring in the upper spine. Now, subluxation is not a dislocation. It is a bone that's just minorly out of place. And therefore, the corrective measures that the chiropractor will put on that puts the levers back in place so the muscles can relax, and also frees up the nervous interference that can take place from pinching of those nerves or extra pressure on those nerves to release that, therefore have better muscle control and better health. Dr. Lala?
Wonderful. Thank you, Dr. Jensen. One of the things that we want to remind you of is that normally we do scoliosis screening in the preschool return to school physical exams in the month of May. And scoliosis screening certainly is an essential part of that as chiropractic physicians. But we found and have such dedicated interest in that we perform those children's scoliosis screenings without any charge all year long. And we're happy to do that. Just have to be patient for us to find the time, but there wouldn't be any charge to do a scoliosis screening on your child if you so desire. The next couple slides that we're going to look at are really interesting. We see this individual here. It's a walker. Correct technique. Eyes front, shoulders back, eyes forward, chuck, chin tucked in, arms closer to the torso, hopefully stomach pulled back in, the shoulders square, elbows back. Keep your back as straight as you can and your buttocks tucked in. And then the next slide below that now is interesting. This illustrates this foot problem that we've been talking about. In this situation, it's a pronation problem where that left foot that you see is turned out. So to avoid pronating the feet, put your foot down on the outer edge when you're trying to step forward, and also try and keep your thumbs turned in. Now the next slide even better illustrates this issue. You'll see these two gentlemen here. The one on your left, as we're looking at the screen, we see that his foot is turned out as he's jogging. But the one on the right is relatively straight, so we have an issue, a foot issue, in the man in the lighter jersey, and we have good foot alignment in the person on your right. Now the next slide that we're going to show you here is also going to discuss this foot issue. And again, feet should be straight, and if the feet are straight, so as you see there on your right, you're going to have a good foot balance, good anatomical relationship in your feet, ankles, knees, your hips, and all the way up through the rest of your spine. And these things are so important, and they're easy to determine. And the only thing you have to do is, when you have these foot problems, they should be made with weight-bearing impressions of the feet. And it shouldn't be like going to Walmart and just trying on a different pair of glasses until you find one that you can read halfway decent. Now here we see on the left, we see the bowed Achilles tendon. It's a line going straight through the calf muscle. It should be straight, but we see that that Achilles tendon is bowed, and that's a pronated foot. And when we look at that foot from the top, we can see that it's turned out or pronated. Now on the far right, we see this person has had a wedge correction. You see down on the heel, we've put a slight wedge in the shoe there, and that has counterbalanced that pronation and put that foot into proper alignment. Now the next one that we're going to look at are some films of the knees, and they're very, very interesting. As I said, all balance starts out in the feet, and it goes into the ankles and into the legs and up into the knees. Now here on your far left, we see the femur at the top of the screen, and then on your far left we see a bone. It's kind of a narrow-shaped bone that's called the fibula, and then the bigger bone next to it on your right, that's the tibia. Now, when we look at those dark spaces where the femur ends and the tibia begins, we see some little dark spaces between that femur and that tibia. And on the inside, that's what we call the medial aspect of that knee, we see a nice open space there. That's where the medial meniscus in part is. But over on the left, we don't see that equal thickness or that equal darkness there. And that's because those knees are not in proper alignment. And that malalignment begins in the feet. It affects the knees abnormally and goes up into the hips. Now, if we look at the picture of this individual over on the far right, we see a similar thing occurring there, but not quite as bad. That cartilage, that medial meniscus and lateral meniscus, the outside cartilage and the inside cartilage are in pretty good shape there. Now, on the outside of our knees are called collateral ligaments. They attach to the lower surface of the femur and down to the tibia and fibula. And then on the inside of the knee, we have some other cartilages too. And those are very, very serious injuries when they have them. Now the next film here
May I make a comment on this one? If you look in the middle of the knee there, on the bottom bone that comes up, the major bone there's called the tibia, and the flat spaces where basically a knuckle type joint comes up there, that's called the tibial plateau. And on the inside, you see those two ridges, and those are called the intercondylar notches. And those are what the cruciate ligaments are attached to. Now, as you can see, there's supposed to be some space between those and the knee. But when you have a disrelationship to the knee, sometimes what those notches can do is those little crests in there can start scraping away at the inside of the knee, scraping away the hyaline cartilage, and start to cause what we call osteoarthritis in the knee. So by having correct alignment within the knee, you will save the knee from down the line of having possible problems of having osteoarthritis and pain being generated in that knee from use.
Another thing that you see in the x-ray, if you look at that knee on your left, on the inside, the back of it there, you see kind of a bright spot, kind of like a moon. And that's actually the individual's patella or kneecap. And that kneecap is supposed to be in the center of that fibula and tibia, and you can see how badly it's shifted. And you see that person is going to sooner or later, more than likely, is highly predisposed to having chronic knee injuries and chronic knee problems. And you can have surgery on those knees, and that's fine if that's necessitated, but you've got to look at those feet and get those feet proper alignment, and then go up and look at that lower back and pelvis to make sure that they're in proper alignment. Well, let's go on and look at the next x-ray now. This is of knees, and this is of a younger person. You can see that the ossification centers or the growth centers aren't complete yet. So we look at the far left, right out front, we see that little glob out there. That's the patella or the kneecap, and the bone going up to the top of the film, almost in the center there, is that fibula or that femur. And then we see most of the bigger, thicker bone going down to the lower right there. That's the tibia, and then behind it we just see a little streak of bone. That's the fibula. Now, in that child's case, they had knee pains and growing pains, and they had gone to a couple chiropractors and to their HMO doctor, and they just said, well, it's growing pains. Well, the issue really was there is that the child had what is called Osgood-Schlatters disease, and it means that there's a ligament, a patellar ligament, it's your kneecap ligament that starts at the lower part of your femur or your thigh bone and runs down a little bit below the knee onto a knob there. And in that child's case, that knob was kind of torn loose, and that often happens when these kids are in very aggressive sports. Even running can aggravate it. Now, over in the far right, on the far right, we're looking at that knee straight through. At the top in the center of the film, we see the lower part of the fibula, and we see that kind of brighter gray area. That's the fibula, or that's the patella, shifted way off to the right. And then we see those crack marks right there. Those are the growth centers. And then coming down on the inside of that film is the fibula, and that's a narrow bone there. It's the one that's easiestly fractured. And then the tibia. And we see some like crack lines up there as well, and that's some of the growth centers in that child. Now we're going to look at some normal posture and how we can develop and hopefully do things to develop normally on the next slide.
Just looking at that slide there, I correct myself, it was the intercondylar tubercles, and then the little area in the middle is called the intercondylar notch. On this new slide here, we have a picture of the spine and the pelvis, and in the middle, on the bottom there, you see that triangular bone, that's the sacrum. And if you ever looked at this old architecture, whenever they have arches, in the middle of the arch is a wedge-shaped stone, and that's what holds the arch up. So we look at that sacrum as the bone that holds that arch, which is created by the legs and the pelvis, as a major biomechanical bone for that alignment. So if you're looking at the bottom, you have the sacrum, which is that triangular bone. Then you have the two iliac bones. These bones do move. There are actually on each side there, when you're talking about the sacroiliac joint, which is the sacrum and the ilium, there's actually two joints on each side there. One is a synovial joint, that's the top one, and the bottom one is a fibrous joint. So those things do move, and if ever you're walking and you put your hands on your hips, you can feel those hips moving back and forth. Above that, as we go to the spine, the next 5 vertebrae up are called the lumbar vertebrae, which are the low back vertebrae. The next ones are the dorsal vertebrae or thoracic vertebrae. To these are the ones that are most easily identified, because normally if it was in the picture, you would see they're the ones that have ribs attached to them, and is part of what we call the thorax. The next ones are the ones that are the vertebrae that form the neck or the cervical area. There are 7 cervical vertebrae, ending in the 2 top ones, which have special names. The topmost vertebrae is called the axis, or
Atlas and
the
Atlas.
Atlas, because if you look back at Greek mythology, the Atlas held up the world. Atlas is the guy who held up the world, and that's what that one is doing, is holding up the skull. And the one below that is called the axis, and it has a little bit of a tooth in it, in which creates an axis for it to spin around. So, for which the Atlas spins around, and therefore you have the greatest amount of rotation in that area. Dr. Lala, any further thoughts?
Well, further thoughts are the program's coming to an end, and we covered a lot of information today and not as much as we had planned on. And if you're interested in what normal spinal health is, or scoliosis, or degenerative problems of the spine, or osteoporosis, you can always call us and request whatever information you're looking for. We have enjoyed having you on House Call today. Remember, your health is the only health you're ever going to have. And you can go and have surgeries and different things, but you need to do what you can do to preserve your health and maintain it as best as you can in the most natural ways possible. God bless you now.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician, in care of Dr. Lala or Dr. Jensen, at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-8521. Thank you for joining us today.